Hello, this is Chris from the Obstacle Doc, and today we are going to show you a variety of shoulder glenohumeral external rotation strengthening and dynamic stabilization exercises to improve the quality and the strength of your capacity to reach and raise overhead, hopefully with no impingement-like pain or altered movement qualities. So when we think about external rotation strengthening exercises, we often think of the very cliche and classic, take the band, anchor it, and rotate out, or lie on your side, take your dumbbell, and rotate upwards. There's nothing wrong with these. They've worked very well for a lot of people. They still are very effective. But one of the things we want to think about is how do we actually facilitate external rotation dynamically through a person's range of motion? Because that's typically where they get in trouble. It's not so much that they can't do it here, but it's more so when they actually try to move their arm in positions of reaching, pressing, and raising where they lack that external rotation control. And as a result of that, they're either going to compress inside and impinge on some important structures, or again, you'll see a breakdown in form or kinematics where you might see a shrug, the scapula is kind of out of position, etc. So here are a few exercises that we can do that look more at dynamic control. One of them is the following. If Daniela takes a resistance band around her wrists, she's going to keep her elbows at her side. At this point, what she's going to do is she's going to rotate outward through both arms. The objective is to get the wrist and forearms to be outside the line of her elbows, suggesting that she is properly externally rotated. Then from this position, her goal is to try to reach up and forward without losing her external rotation position. The nice thing is this exercise is done at the same time, so she can compare both shoulders dynamically on the fly. And for clients who have difficulty in doing this, typically they will feel it will be harder. They might sense more fatigue or burn in their involved shoulder. Things that we can also look for is when a person is raising up, if they cannot keep their external rotated position, that arm will fall inward, whereas the other arm will stay outward. You might see a shake or a tremor. You may also see a shrug, which would make sense because now this shoulder is trying to hike and heave, whereas this one is rotating and coming up smoothly. So bottom line, as a projection for this one, if the person can stay rotated and they can come all the way through range to full extension, even higher, and then come back down, that would be a good clearance for this test. There are variations of this exercise against the wall, sliding on a wall, using a foam roll, but this is one option that you can do. I would recommend using this in front of a mirror. That way you can watch your form on the fly so you can tell when things are breaking down. If you can make adjustments as you go, that's more effective than trying to reactively correct, because at that point, the problem's already occurred. So doing it in front of a mirror is going to give you a lot of information. Another set of exercises we can do that look at external rotation control on a single arm press. Think of our overhead presses, our shoulder presses, our bar work, our dumbbell work. This can be a great idea for those clients. So you're going to take your TheraBand with 2 loops, take any rigid pillar or post. You're going to weave through and then depending on your height, you can kind of dictate at the level. Typically we go for shoulder level when we look at this. So the idea is the following, is Daniela's going to grab the other end. She's going to step back or take up enough slack out of the band so that the following is going to happen. So she's going to kind of go into a genie position. So this acts as a platform for the involved shoulder to rest on. We're going to double check that she's not shrugging. At this point then, she's going to take the band, she's going to externally rotate first to get our stability, and then off of her next external rotation, her goal is to try to go into her overhead press without the band pulling her into internal rotation, and then back down. Now, if she thinks she loses it, she can always reset and go again. If she thinks she's kept it, when she comes back down, she'll just go right back up, and we're just going to work on repetitions. At that point, the offhand can palpate onto the upper trap or the neckline, shoulder line area, and we're looking for early shrug signs as she goes up and down. We also want to play with trajectory because obviously a myriad of different presses can go from different angles. So we can also change trajectory to kind of emulate different press planes of motion. So if Daniela faces forward, keeps her arm out to her side, now at this point, if she rotates backwards into external rotation, we have no shrug here. She can place her offhand on top to validate. Now she's going to go up and down into her overhead press with the objective that the band does not internally or de-rotate her position as she goes. Again, this is a great opportunity for her to appreciate dynamic glenohumeral external rotation control through the rotator cuff interval as she does a myriad of different overhead presses, which can be good for any overhead press work, cleans, snatches, basically anything where the arm's going to go overhead in a nice finishing position. All right, as another exercise that we can look at to target external rotation control, say in a forward raise to shoulder height, where you can see a loss of external rotation and that shrug sign, especially in individuals with cuff weakness, is the following. Using the TheraBand to create a resistance through the rotation so that the client has to actively externally rotate against it. So it's almost like a reactive neuromuscular feedback loop. So she's going to feel the internal rotation resistance through the band with the following, which is going to allow her to want to externally rotate to do the motion correctly. So if she does it correctly, odds are the motion will look better, feel better, and be stronger. So with the band, 2 loops on the end, we're going to come underneath and we're going to thread the band through the loop. We want to keep this kind of relatively high near the armpit, being careful not to choke her off. But then at this point, we're going to start to wrap the band in an internal direction, applying resistance as we go. We need enough band so that we have excess for the bottom to apply an anchor. But at this point, what she should feel is that the shoulder itself is internally rotated. So if I anchor this down onto something, we're going to use the kettlebell, and then she's standing appropriately. Now, before Daniela does anything, she's going to feel this internally rotated. So what she's going to try to do is externally rotate against the band, applying a proper glenohumeral position. And now she can do forward scapular plane elevation while that band is dynamically trying to internally rotate her arm, so she has to stay in that externally rotated position. We can start with no weight because our arm already weighs something. This can also go with dumbbells, working our way up the chain, providing that stability as we go.